As pre-medical students, we are often asked questions like, why medicine? And how do you overcome challenges in the face of adversity? So we thought, who better to ask than current medical trainees and established physicians? This winter, I got to sit down and speak with several members of the Mallory-Wilson Center's Board of Alumni to learn more about their journeys of becoming a physician. So without further ado, go ahead and take a look.
So my name is David Daylaw.
My name is Michael Moore.
Hi, I'm Julia Barrett.
My name is Kyle Hogarth.
And my name is Dr. Jessica Walpole.
I'm a practicing head and neck cancer surgeon in Indianapolis at IU School of Medicine.
I work at the University of Chicago, where I'm a professor of medicine here. I am currently the director of the bronchoscopy program and the lung cancer screening program. I'm a pulmonary critical care doctor, board certified in both of those.
Faculty at the Icahn School of Medicine at Mount Sinai. And I'm an internist and a pediatrician. I do general care for both adults and kids. And with that appointment, have a lot of teaching activities with both medical and pediatric residents as well as medical students at the university.
The Indiana University School of Medicine, which is where I still am at. I'm a fourth year currently, and in the future, I just finished interviewing actually for my residency programs. So I'm planning on going into pediatrics and then hopefully further down the road a fellowship.
I am a second year psychiatry resident at The Ohio State University Wexner Medical Center. I graduated from Miami in 2015 and went on to complete my medical school education at The Ohio State University College of Medicine.
You'll never regret, a career in medicine. I think it's, the most rewarding path you could find.
Early on in high school, I realized that I'm definitely a people person. I needed something career-wise that was going to allow me to interact with people on a daily basis. And that meaning talking to them, being with them. So COVID's pretty challenging, but I kind of quickly narrowed it down to law and medicine. My dad's an attorney, and medicine was just kind of something I was like, oh, that'd be interesting based on what I had seen on TV. I had no physicians in my family, so honestly, like my interest came from Grey's Anatomy, which I think happens to a lot of people. But then looking at those two specialties, or those two careers, law I thought was interesting because it allowed me to really use like my intellect and my problem solving abilities. But I realized that oftentimes people are angry and upset, and they come into the office with problems and you can't always solve the problems. And while that's similar to medicine, there's so much joy in medicine. You get to be with patients where they're at. You get to be with them at the lowest points. You get to be with them at the highest points. You get to hold their hands as they're dying. You get to hug families during the birth of their first child. I mean, there is no career that even remotely touches the experience that you get to have within the medical field.
It is never boring in medicine, ever. Every one of my days is different. Every patient is different. Every disease is different. I don't have the same day when I wake up. And my biggest fear in life was to be bored out of my mind. I guess I would reflect on, think of every great class you've taken and you were really excited about it. And then think of some class that, maybe you had to take it or was a requirement for X, Y, or Z, but you didn't, it was not about the professor. It just wasn't a subject matter that really got you pumped up. And every day you had to go and every day you had to fake it. Oh, could you imagine doing that now for your entire career? No way. Medicine is always exciting.
One of the things that I love about medicine that separates this career from like anything else for me is how much learning there is. And like, I just love learning. It's maybe a little bit nerdy of me to say, but in medicine, there are like constantly new developments, there's new drugs, there's, new genetic mutations that are being found. And so like the rest of your life, you're like signing up to learn about new things. And I just think that's the coolest thing ever. Like there are always going to be new advancements, and something that you would have given a patient yesterday might have a better solution today. And that is just one of my favorite things about it.
To me, success is being defined by the patients whose lives you touch. And some of that's reflected in the simple things like cards you get, just thanking you for what you did, the hugs you get in clinic when you've done things to help a patient breathe better, and the family can see a substantive change in their loved one. To me, that's actually maybe even more so why you get up in the morning.
I guess I think the best way for me to answer that is to say that I hope, like most others, I've always wanted to be, successful at what I did in medicine. And to me, that meant providing really good patient care. And since during my residency, I quickly realized I also wanted to be an educator in medicine, to be a good teacher. And I think because you grow accustomed all the way from college up through and having some sort of external validation of your work, maybe I viewed the validation that I was a good clinician and a good educator by receiving clinical promotions at my institution. And in other words, being promoted from instructor to assistant professor to associate professor. And in terms of education, maybe receiving teaching awards and those sorts of things. And as I become more senior in the game of, or not the game, in the game of life, in the practice of medicine, I think I've realized, to me, it's much more personal how I measure success. It's kind of that immediate relationship and feedback I have both with my patients and with trainees that I think I measure success by. I feel like if I get good feedback from those two groups, that I'm doing a good job being successful. That I was having growing families of patients for whom I was caring, and what that meant to me is sometimes I might pick up a new patient who was a newborn out of the nursery. And somewhere along the way, the parents said, hey, do you have anyone you could recommend, me seeing? I don't really have a long-term doctor, and I know now that I've, delivered, I need to see someone, or my husband's not completely well. Could you see? And I said, well, I see adults too. And then suddenly, like, wow, could I see you? And then the next thing I know, I'm taking care of them, and I'm taking care of the spouse, and I'm taking care of grandma, and then the cousins are coming in, and that suddenly makes you feel like, wow, these people trust me, like enough to not only bring their initial patient care back to me, but to actually entrust their loved ones to recommend me to them. This resident just said, I remember being a medical student and deciding to go into medicine and pediatrics because I worked with you as a second-year medical student just for a couple sessions, and I just thought it was so exciting the way you talked about things. And then she became my resident, and I've advised her throughout. And I just think, like, for her to come back and say, like, I really modeled my career and decided what I wanted to do because I felt like I looked up to you. That means a lot, right?
When I was younger and maybe didn't have as much maturity as I do now, I saw success as something that was much more how other people perceived me, or if other people were impressed by what I had done. But now, as I've grown, I've learned that success is much more about what goals you've personally achieved and how you feel about this, the successes that you've done. And so I think that's given a lot more peace of mind as I've grown older, just setting goals for myself and achieving them on my own and not worrying what other people think or say about them.
Success changes. So now my success is, the people I work with, how can I put them in a position to realize their goals and their dreams?
Coming out of Miami, being a pre-med student, the definition of success is getting into med school. For me in med school, the definition of success was obviously to do as good in classes and stuff as I could. But I think looking back on it now, I would say the point of success for me in medicine was deciding what I wanted to do in medicine. I was someone that came into med school thinking I knew exactly what I wanted to do, where I wanted to go in life. And I actually allowed myself to be open and pursue other interests. And so did a complete 360 in terms of the specialty I wanted to pursue, the career that I wanted. And so for me, I'd say the success has been just allowing myself to be flexible and change what I thought I wanted to do. In residency now, I would say, I mean, success wise, getting my first choice in terms of matching for residency, that was a huge plus. But now getting to work with patients, I would say it's the small victories that really define success as a resident. Now that I'm taking care of patients and teaching med students, there's nothing more rewarding than helping a patient feel better and get the life that they want back, or create the life that they want. And then working with learners of various disciplines, like helping them really understand concepts and master skills in terms of interviewing patients and showing empathy and compassion. That's the kind of stuff that I would say are like my day-to-day successes.
Well, I certainly remember one that stood out. So, being a townie, you don't really didn't separate yourself from your home life as much as maybe you initially should have when you're starting out. And at Miami, I was a first year or freshman, and I remember staying up all night, classic, writing some term paper that was due the next morning. And at like 6:30 or 7 in the morning, I realized I had my first calculus exam at 8, and I hadn't studied a minute for it. So I had always been pretty decent at math, so I figured, yeah, I'll just be able to go and do this. And I think I was so sleep deprived, I left there thinking I did pretty well. And at the time, I was doing a lot of other things outside of school. So I was, running track and working probably 20 to 30 hours a week as a dishwasher up at Ozzy's, which was, I don't think it's there anymore, but it was a bar and grill uptown. And I remember going and getting my exam back, and it was a D, and I've never had a D. I certainly never had a D in math. And so I left there, and I just remember walking and telling the professor, I'm like, all right, well, I just want you to know from this point forward, I'm going to work to make sure I do a lot better. And I did. I went and I took the bus right uptown. Essentially, the gist of the story is I got, my priorities where they needed to be. So I went uptown and I kind of gave my notice for my job. Still kept running track. I did that all the way through, but I really disciplined myself to focus on the priorities at hand. And I think a lot of times during your daily life, whether it's your day-to-day life or your career, there are going to be times where you're overextended and you have to prioritize, and you have to then be able to focus. And I was fortunate to be able to overcome that and then, maintain a good score at the end of the semester.
The greatest one, I would say, happened during my first year of residency. In the first few months, I was actually an intern working in the intensive care unit at the Veterans Hospital associated with the University of Cincinnati there down the hill off of Vine Street, and spent a lot of time at the VA. But at that particular month, I was one of 4 interns working in the unit and was on call every 4th night. And one of my first call nights there, and again, there's critical care that patients are very, very ill. I had one particularly rough night with admissions, and that and ultimately overnight there were 2 patients that passed. Now I was there with a senior resident on the floor, but I felt ownership for the patients. And rounding the next morning with the fellow, the other residents, the attending physician, felt considerably heavy to me as I did my new admissions, but also had to kind of discuss with the attending what happened with the patients that didn't make it through the night. And I think you carry that feeling with you. Certainly I did that day when I went home, trying to figure out how I had failed and thinking, whether or not I was cut out for the field. And I think the way that I bounced back from it was just talking on a regular basis in the ensuing days and weeks with, probably not as much the attending, but the fellow who was supervising the unit that month, and getting his feedback and kind of reviewing the cases again and going back to him and having him reassure me that, the right things were largely done and that the patients were ill. And that's why they were in the intensive care on ventilators. And the outcome may have been the same regardless of who had been on call. And just kind of, I guess the way I bounced back with it was just in time, that kind of support, but also the understanding experience that as a physician, you have to accept that sometimes outcomes are not favorable for patients. And in fact, many times when you're in a critical care setting, and that you have to do what you always think is the best for the patient. You have to make good decisions based on the evidence in front of you. And sometimes, no matter what you do, even if it's all the right things, the outcomes aren't going to be great. And again, it's not an easy lesson to learn.
For step one, which is the first of many, many board exams, I had a really hard time. And I was someone that going through high school and college, like I had always done well academically in terms of homework and exams and standardized tests. Like the MCAT's not fun, but it was okay. I got to step one and I really struggled. It was hard to sit for 15 hours a day doing nothing but keeping my nose in the books. It was hard to motivate myself for weeks on end when that personal connection, like the whole reason I went into medicine, wasn't there. Most people study independently, and I struggled not only like intellectually in terms of grasping the content, getting the answers right, getting my score up where I wanted it, but also mentally and emotionally. It was a very, very challenging time. And the first time really that I questioned if I should even keep going. I called my parents about 2 weeks before my board exam and told them that I was done, that I didn't want to keep going anymore, that I wanted to be done with medicine, that nothing was worth how I felt, how defeated I felt, and how overwhelmed I felt when trying to take step one. Thankfully, my parents are wonderful and supportive and drove to Columbus and picked me up and took me home. And I finished my 2 weeks of studying at home with them with lots of love and support. Ultimately, I did fine on the exam. I exceeded the score that I wanted to, but it was a very, very challenging time. It was the first time academically that I wasn't sure that I could do what I knew I needed to do. And that for me was tough. And I would say now looking back on it, in medicine, everyone has those moments. Everybody has a period where something goes wrong, where they don't succeed, where they don't understand something, because it's not possible to understand everything in medicine. So I'm very thankful now that I had that experience early and learned how to get through it with the support from family and friends. Because I know that that's going to keep happening. There's going to be times where stuff happens at work that is just going to be difficult, and having that support system to help get me through was super important. And I'm thankful to have come out the other side smiling.
I got a patient admitted to me at 7 in the morning, and for literally 12 hours straight, I almost never left his bedside. It was unbelievably sick in the intensive care unit. I worked on him continuously. He still died at 7 p.m., and I still had 24 more hours of my shift. This is prior to work rules, so
Yeah.
I'm exhausted. But what you can also, where you get energy from these sort of bad outcomes, is so, this gentleman had a large family. And so throughout the day, as he was getting sicker and sicker, more and more people kept showing up. So outside of the intensive care unit, at the time of his death, there quite literally were 50 family members. And when we called the code on him, I could hear the screaming in the hallway from just the because the family knew what that meant. And when we were unsuccessful, I walked out like just exhausted, my head slumped down like a failure, and to talk to the wife and obviously the extended family about how we lost him. And what I think helped me define how I practice was all throughout the day, I made sure I kept coming out to talk to families. I kept letting family members come in to see him, to see what we were doing. There was no mystery about what was going on. They could see that he was getting sicker. I was explaining why he was getting sicker, what we were doing to try to intervene. So communication is the key to this whole thing, because then as I walked out feeling like an abject failure, I had failed at my job. He died. But what I actually then realized that day, and I'm glad I had this experience early on, was I didn't fail at my job, because he was going to die no matter what I did. What I actually did was lead the family through the dying process. And that when I came out and told them, they all collectively hugged me.
I have is from Miami, actually. When I first started freshman year at Miami, I, was super ready for my classes and very excited to be a college student, but I definitely felt like I could just handle classes and schoolwork like I did in high school and do the same things that I did in terms of like studying and preparing for exams. And I quickly found out that what I did in high school did not work for college at all. And the first semester was really rough for me. It was by far the worst GPA I had ever had. I really struggled with getting good grades and just like staying afloat in my classes. And so when I finished up the first semester at Miami, I I was really sad at like looking at my GPA, and I was like, this is not going to get me into medical school, which was my dream. And so I really had to sit down with myself and figure out how to fix it. And that involved kind of creating like a whole new study plan and developing a new way of me to like being a student. And I implemented it when I started back my second semester at Miami, and it really worked. Like I was able to fix my problem, figure out how to study better. And it was really rewarding, not only because my GPA went up significantly, but it was very validating that like if there's a problem in my life, like I'm in control and I can like change the course of my path if I want to.
So as someone who went to Miami and was a pre-med student at Miami, I think going back, what I would tell myself now is it's not all about med school. It's not all about medicine. It's okay to be a normal college student. It's okay to take time for yourself and to do fun things with friends instead of studying extra for tests. Medicine's always going to be there. There's always going to be more time for you to explore other opportunities, but make sure that you're making the most of your Miami experience while you're there.
Keep things in perspective, for one, and I think staying well-rounded is critical. It's so easy to keep looking at, I need to get through this, I need to get through that, and then 10 years from now, my life will be where I need it to be. And it's all a journey. Like I realize it now. Schedule's busy and we're, running around to a bunch of different things, but my son's 8 years old, and this is the one opportunity I'm going to be able to go home and spend time with him when he's 8, and develop these friendships and get to do stuff with him that I'll never get a chance to do again. And so, stay in the moment as well. And that's at work, that's at school. And then I think the other part is just don't get too high and don't get too low. There are plenty of times where things will go really well and you'll score well, or you'll get into the school you want, or whatever that may be. Keep it in perspective, keep humble. But at the same time, when you have a setback, don't let it derail you. Just kind of say, all right, and that will happen in medicine. If you go into medicine, there will be complications, whether it's, care for a patient or otherwise. And that patient and other patients will depend on you to be able to acknowledge it and talk to them about it, but then still to get your mind back on what needs to happen to get things moving in the right direction. And so not too high, not too low. And I think that's one thing that will really help allow for career longevity. I think burnout is real if you really allow it to be. And so to keep perspective and to really try and keep an even keel is, I think, a critical part of that journey.
Want to be in healthcare professions, you have to be willing to accept adverse outcomes, because no matter how good you are, how much knowledge you have, how skilled you are technically, if you're a surgeon, there are going to be bad outcomes. No physician or other healthcare practitioner has the all ability to make things right, so to speak. So you have to be willing to accept that. Piece of advice I ever received, and I give it all the time, is it's twofold. Do not be too proud to understand your own limitations. And then with that means don't be afraid to ask for help.
Being in medical school, it's tough. Like, you are studying a lot. It's, information overload, and it can be really stressful. And especially during those first 2 years when you're in classes all the time, it can feel like you just have to study like nonstop, and you don't have time to do the things that you love that are not medicine related. And so looking back, like if I could have redone anything in my past 4 years of medical school, it would have been those first 2 years, like doing my passions and doing things outside of medicine and taking time each day to just like turn my brain off and do what I love, which is like playing the piano and baking and hanging out with friends and, watching a new Netflix show. And I just didn't do that enough. I really like stressed myself out and told myself that I needed to be studying like nonstop, because you're always seeing your peers studying and think that, oh my gosh, like they're getting ahead and I need to catch up. And wellness is just really important. And I think it's a life lesson. It applies to, med school, college, residency, beyond. Like you always have to make time and really be really intentional about the things you love that aren't medicine, because medicine is awesome and it's really easy to just become like fully encompassed in it, but there's so much more outside of medicine to make you like a complete person. And so that is the biggest thing that I've taken away from med school that I wish I had done differently.
It is so important when you're going through the pre-med process, the med school process, residency, everything, to remember who you are as a person and what's important to you. It's really easy to get lost in all of these check boxes and the next thing that I have to do and trying to keep up with everybody else around you, that it's very easy to lose yourself and what's important to you and what you're interested in. And if you kind of keep that at the core while you explore lots of options, and I was always the yes person. If somebody said, hey, you want to do this? My answer was always yes, 100%. I would love to try it. I think learning how to say no is important, and learning how to say yes and try something and then say this isn't for me is really important, because there's gonna be endless opportunities throughout your life and throughout your career, and people are always gonna want you to do more and explore more, but making sure that you take time for yourself and things in life that are important to you is so important to be a good physician, to be a good med student, to be a good person. Um, Now, as a psychiatrist, if I didn't have outlets outside of work, if I didn't have interests outside of work, you would just be emotionally exhausted. I mean, you talk to people all day, every day that are going through things that I can never even imagine. And it's really hard to not let that affect you. But being able to come home at the end of the day and have stress outlets and things like that, that is so important. And the earlier you develop them, the better.
My hometown is an exceedingly small hometown, 2,500 people north of Oxford, Ohio, about an hour. And it is known for farming more than anything, but probably what its backbone is an employment standpoint is they have a huge um, factory for the production of medical tables and chairs, interestingly enough, working on the factory line assembling tables. And it was the most arduous experience of my life, starting at 6:30 in the morning until 4 in the afternoon, sweating, putting together medical tables and chairs. And about midsummer, I wanted to quit. My dad told me, "No, we don't quit things. You don't have to reinitiate, but you don't quit." And it was absolutely the best job for me ever, because it really reinforced that is not an easy life. I have a lot of respect for people who work in manufacturing and more blue collar jobs, but I knew, fact certain, that I was not built for that life. I wasn't quite tough enough, and it really was a motivating factor. Thereafter, when I was in college, I was a summer kind of desk monitor for summer camps there on campus. And my last summer before I went to medical school, I actually waited tables for breakfast and lunch at Houston Woods Lodge.
I had my greatest job ever was working in a movie theater. It had 8 screens. My buddy worked across the street at another movie theater with 7 screens. We saw every movie that ever came out for the 2 years that we worked there in high school. And you could always I could go to a movie for free, and I could take a date for free. And my meager paycheck at $3.35 an hour, because that was minimum wage, I could actually take someone out for dinner and then in a movie, be the true gentleman, old school.
I used to be a dishwasher at a bunch of places in town. There was one restaurant, I don't know if it's still there, called DePaulo's. It was a French restaurant. And I remember I was working in there in the summer before my freshman year. And I remember very distinctly that I had freshman orientation, and I told the guy that I needed to take off of work one day so I could go to freshman orientation and go to college. And he said, "You know what? I think you got to get your priorities in order." I said, "All right, I do. And you can take this as my 2-week notice." And so, and so from that point forward, I realized that was not going to be my long-term career path. But yeah, I did that, worked on the grounds crew, the painting crew at Miami, a bunch of little odds and ends jobs like that.
at Miami, actually, worked at the Ranella Learning Center, tutoring other students. And actually, I would say that was probably one of the most impactful things that I did at Miami, because it's actually changed part of my kind of career path in medicine. So now I actually have a pretty significant passion for medical education. As a resident, I'm getting a master's degree. Essentially, it's a master's to learn how to teach adults, meaning like med students, residents, fellows, and hope to make medical education and kind of like the medical training a pretty significant part of my future career. So that interest actually started at Miami and is something that I've kind of continued to expand upon throughout med school and now into residency.
So my favorite place to eat in Oxford is Skipper's.
I have two favorite places in Oxford, and every time I go back to Oxford, I go to both places because there's no replacement outside of Oxford that I have found. And that is the Mac Bites at Skipper's and the Borzenburger at Sohai. Those are like honestly two of my favorite foods. They're only in Oxford and they're amazing.
So Skipper's Pub was one of my favorites, still is. The food there, I loved it, and a good friend of mine worked there when we were growing up. And the Bagel and Deli, obviously right next door, are some of my favorites. My mom still lives back there, so I love to go back and go to those places when I visit.
Favorite place to eat in Oxford? I know it's not there anymore, but I used to absolutely love the lavaches at Quarter Barrel. They were my favorite, and every time I came back I would eat at least 3 of them, and I would take many of them home. So I'm very sad it's not there anymore, but that was by far my favorite place to eat in Oxford.
I hope you enjoyed this video and were able to learn from it or resonate with it. As you can see, everyone's entry into and experience with medicine is unique. So remember to believe in yourself, embrace challenges, and continue to seek out opportunities of growth.
It's really a privilege to do what we do. And I think not to take that for granted is a really important thing.